Let's take a moment of silence to think about our task tonight and to maybe perhaps be in prayer for our students and their families, our leaders, state, local, and national, and the people that they lead, and our country, and our healthcare workers. Please join me. Thank you. This is a non-voting work session, and typically in a work session we meet to discuss a very narrow set of topics or a single topic, which is what we're doing tonight. As I said, it's non-voting. We'll hear presentations and have discussions on, of course, our Return to Learn program. So that being said, I'd like to turn this over to Dr. Snowden.
Thank you. First, I'd like to begin by acknowledging the many hours of discussion and collaboration by our leadership team to develop this draft plan to return to school. Also, there's been a great deal of collaboration with the county's emergency management agency, health officials, and also with Williamson County Schools. We also acknowledge the parents and our employees who completed the survey and gave us some valuable information, and who have also provided input through email, social media, and through some individual school conversations. The goal of this work has been to develop the very best educational options for our students, staff, and parents in an environment that focuses upon the health and safety of everyone. We strongly believe that attending school physically provides the best teaching and learning environment for most students. Our survey results confirm that most parents are looking forward to having their children physically back in school. Other parents have indicated they prefer to have their children remain at home instead of physically attending school during this pandemic. Therefore, we have planned to provide instruction with students physically in school, and we will also provide a virtual opportunity for those families who decide that is best for their children. And let me emphasize this: due to the ever-evolving nature of this pandemic, please realize this plan is and will remain fluid, and adjustments and modifications will have to occur as circumstances change. As you've seen in the draft plan, there are 4 major components: teaching and learning, student, staff, and family support, professional learning, and operations, which include transportation, food service or child nutrition, plant operations, and physical health. We're going to start this evening with the operational component of the plan, which begins on page 17. The component will be discussed by Dr. Esslinger, Associate Director of Schools for Finance and Administration. Other members of the leadership team may also contribute. After completion of the operations component of the plan, we will go to page 2, where Dr. Decker, Associate Director of Schools for Teaching and Learning, will discuss the other 3 components. After discussion, we will provide responses to questions we've received. Dr. Barker sent many questions she had received from parents, and there are probably others as well. In addition, an FAQ document will also be forthcoming to help parents find information more easily, because we know this document is quite lengthy, so that's the plan forthcoming. So, Dr. Esslinger, turn it over to you.
Okay, thank you very much. Good evening, everyone. We will spend some time talking about our operational plan to the Return to Learn plan we have for this school year. So we'll start with transportation. And I'm just going to review some highlights. I know you've already had some time to review this document. I'll walk through this and point out some of the most significant pieces, and just stop me along the way if you want to focus on a specific area, or if you want me to dig more into the weeds. We have our staff here also to answer some questions if they get beyond my knowledge. So, with transportation regarding bus drivers, of course, They will be under the same scrutiny regarding screenings on a daily basis as all other staff. All drivers will be issued cloth and/or disposable face coverings and are required to wear them during the duration of the run. And transportation team members will receive direct, specific training regarding protocols, specifically around cleaning and how to disinfect the bus every day. Student riders are all expected to use hand sanitizer prior to entry on the bus. Hand sanitizer will be provided upon the door of the bus. All riders will be required to wear a face mask covering during the duration of the bus. Transportation, we are expecting students to provide their own face mask covering. However, we do have disposable ones at the ready should we need to give those out, but we would prefer, and students would probably prefer, to wear their own comfortable face mask rather than the disposable ones that aren't the most comfortable. Students will be assigned to seats on the bus, and there will be no more than 2 riders per seat. All riders, our siblings and members of the same family will be directed to share seats to help keep the contact at a minimum. Parents or guardians are asked to reiterate the importance of these safety measures to their children, and when feasible and reasonable, parents are asked to decrease the school bus load by driving their children to school and picking them up from school. We hope that will alleviate some of the bus two-to-a-seat issues we may have. All active buses, I'm on the next page. All active buses will be sanitized on a daily basis, including high-touch surfaces after each route, of course using approved sanitation products. Any questions regarding transportation? Yes, sir.
I have one. On student riders, all riders will be expected to use hand sanitizer each time they board the bus. Does the driver have the authority, if I could use that term in this context, to say you cannot board the bus unless you do use it?
I would assume so. Yes, sir. Now, there is a dispenser on each bus, so there's really no excuse for a student not to use it. It's not, they don't have to provide their own. They'll hit the hand sanitizer as they come into the bus.
Okay.
Yes, ma'am.
Okay, so do some of our buses run routes for more than one school? Because we're at different times. Is there enough time in between running the route and starting a new one?
Yes, they'll wipe down high-touch surfaces in between routes. The full disinfection of the bus will be after morning route and after afternoon route. That's where we will actually spray down the bus with a disinfectant, an approved disinfectant, and it'll allow it to dwell and sit and do its job and be ready for the next route.
And this is more of a comment than a question. I don't expect all the details to be right here, but I just would encourage us to educate our drivers on the CARE Act in terms of if they feel they have symptoms and normally they'd want to push through and drive a little ill.
Oh, absolutely, yes.
We want to encourage them to realize that they'll still get paid if they don't go to work that day.
Yes, that's on emphasized in our under the physical health component. We will emphasize that with all staff and faculty. Anything else under transportation? Yes,
I
ma'am.
may get to this, but did we decide to not do temperature taking getting on the bus?
Correct.
When they get to school?
Correct. Okay, moving to food service. Our child nutrition program will be monitored following the current state of Tennessee CDC guidelines. All child nutrition staff will wear gloves and masks at all times. Students will practice social distancing during their time in the serving area and in eating areas. All individual food items will be wrapped to keep the cross-contamination down. Touchless checkout through the point of sale software is already in place, where students will have their barcode ready and it'll be zapped. Depending on schools and their schedules and their facilities, lunches will be consumed in different locations so that social distancing can be maintained. That's a campus by campus situation. The number of students, the square footage of the cafeteria, there's a lot of variables there that just allow us to, or have us provide that freedom for the administrator. Tables, of course, as they have been done for hundreds of years, wipe down and sanitize between every group as they use the next table. We are using the CDC approved sanitizer rather than what we may have used last year. Questions regarding food service?
I do. In reference to breakfast, I know we've referenced lunch here. Normally that's consumed in the classroom with the carts.
Not normally. In some schools it is. In other schools it's not. The same protocols will be followed here for the breakfast. Breakfast is easier. Not as many children participate in breakfast in the morning, so they can be spread out and socially distanced in the cafeteria without probably thinking about other locations. But the same protocols will be in place for breakfast.
And the same touchless carries throughout the school. I've never known about the touchless system in order to...
Yes, it's a barcode system.
Okay, great.
That the cafeteria staff member is at the cashier. The child doesn't have to touch anything. He scans their card, and then their account comes up, and they charge the account.
Great, thank you.
Anything else with food service? Moving on. Plant operations, custodial, maintenance, and landscaping. Now, needless to say, the buildings will be cleaned and sanitized thoroughly prior to occupancy each day. That primarily will be done nightly with our night crew. We have some shifts that are going to be, some schedules are going to be shifted to give the night crew a little more time to go into every room and thoroughly sanitize each room, spray down certain areas, with special attention to the areas listed there below, and specific attention given to those areas that are high traffic. Students are encouraged to bring their own water bottle. Water fountains will only be used to refill and not be used to actually drink out of. Any area where students and staff frequently interact will take priority and will be cleaned with increased frequency throughout the day by our day custodian. So that's one of the roles of the day custodian would be to constantly clean the areas that are of high frequency, handrails, fountain or faucet handles, light switch areas that are touched frequently. The day custodian would be on top of that, typically like we do in flu season. That's not uncommon. And during flu season we ratchet up the disinfection rate with our day custodian, and we'll be wiping down throughout the day. Maintenance services. HVAC systems in all facilities will be inspected for air quality, and all units will be in operation prior to arrival each day and left on during unoccupied times to maintain airflow, to keep air moving in the classrooms and in the halls. Landscaping services will pretty much remain the same, other than following the CDC guidelines and the PPE requirements when they if they should need to come into the building or when they're with each other in the vehicles. Any questions regarding this section? Physical plant operations, custodial maintenance?
I have one.
Yes, ma'am.
I know we don't employ a lot of custodians. What happens when we're down a custodian or two?
We have 2 floaters
Okay.
that are hired. They're like permanent subs. They float throughout the district. And when one custodian is absent at a school for a day or 2, then the team at that school typically covers their load. If it becomes longer than a day or 2, the floater will be assigned to that school until the custodian returns. So if a day custodian is out, one of the evening custodians will be called in, or someone shifted from another building to cover the day custodian's duties.
I don't have a question, but I do have a comment. Several years ago, as you recall, we made a decision to keep our custodial staff as employees and not outsource that function that, like some other districts have done. And I think because of that, we can walk through any school and see that it is absolutely spotless. I've been through some of our schools just at random, and I'm impressed by how clean our custodial staff keeps our buildings. So knowing that these fine people are responsible for these extra duties, that gives me a great comfort level.
Appreciate you saying that very much. And that's on a non-coronavirus year.
Yeah.
We are in good hands, I believe, regarding this. And there will be some extensive meetings and trainings prior to school starting, the first opening days of school. They've already had experience with this last spring, so they've been down this road already a few times as far as expectations for sanitizing and cleaning during the March episode. So that I have confidence in them as well. Okay, moving to physical health. So before anyone comes to campus, as you've experienced this evening in the front hallway, we will be asking and expecting people to review those questions that I'm sure you've seen in multiple environments already in the past few months. And I will spend a little more time regarding the next 2 sections. We've taken this section and broken it up into 2 parts: upon arrival to campus and on-campus guidelines. So I'm on the next page there, Mr. Anderson. There we go. So upon arrival to campus, all students and staff will be screened prior to entry. They must wear a cloth disposable face covering at the screening location. They will have their temperature taken with a non-contact thermometer, use hand sanitizer prior to building entry. Students who have a temperature of 100 degrees Fahrenheit or greater will be supervised in a designated room where their temperature will be taken again with an ear or oral thermometer. Anyone who fails to meet the screening criteria or has a temperature reading of 100 or greater will not be allowed to enter the building or participate in activities, meetings on campus. Students who do not pass the second screening process will be supervised in a designated room until parents can pick them up. Parents and guardians should plan in advance for a designee to pick up children if needed. Children who do not pass the screenings must be picked up promptly. Visitors who do not pass the initial screening will be asked to leave the campus. Staff members who do not pass will be directed to go home, but let their program supervisor know first. To minimize potential exposure, only authorized visitors are allowed entrance past the front office. School staff will receive students at screening stations to prevent unnecessary adult entry into the building. Visitors are restricted from entering the building during the school day unless the visit is deemed essential. Temperatures will be checked if individual is planning on staying on campus. If you're not planning on staying on campus, for deliveries or pickups, temperatures will not be taken. Upon or on-campus guidelines. Disposable or cloth face coverings must be worn by all staff, students, and visitors while on school property. Group rosters will stay as consistent as possible, and mixing of groups will be avoided when feasible. Social distancing guidelines will be followed, and of course we will have several times throughout the day where we will be washing and sanitizing hands in a concerted effort. Then at the bottom there, that says supplies to aid in health and physical safety will be provided to schools. We are set to go. We've ordered cloth masks for every employee in the district. We have all supplies ready for the screening stations that are needed, and we have supplies ready to get us started. And we know there's a lag time, so we've got a good 9 weeks set to go. Questions regarding this section? Anything? Hearing none, I'll move on. The next section is a specification on the community spread metrics and the details around the metrics. I think the top paragraph is probably the most important that we need to look at this evening. Once the indicated illness spread is reached at each level, a systematic review of local metrics will be conducted with Williamson County health officials, including illness spread by zone, clustering data, absenteeism of students and staff. This review will determine if the district moves to the next level. FSSD will consult with public health officials prior to finalizing a decision to close a school or the district and how to reopen, as well as any modifications made to the FSSD Return to Learn plan. So we do have three metrics here. Minimal spread. This is where students will be on campus or online, virtual, and that would be the parent choice. Disposable or cloth coverings must be worn by all staff, students, and visitors while on school property. And the other pieces to that are listed there, which we've pretty much already covered in other areas. If we get to a moderate county-wide spread, which is 0.5% to 1% of active cases in our county, buildings will be at reduced capacity. Select small groups of students may attend on campus. This may include some students with disabilities, some English language learners, other students that would require intense academic intervention or behavioral intervention, and pre-K through second grade. Virtual instruction will be in place for all other students. And again, disposable cloth face coverings will be worn, and social distancing guidelines will be in place as well. If we should get to substantial spread, an even more select group of students may attend on campus. Virtual instruction will be in place for all other students. The rest of the components are pretty much the same in that section.
I have questions about that. My question about the metrics is that I think we talked about this before. We are using that as a guideline based on recommendations by the Public Health Department. Are all districts in the state using these guidelines? The 0.5, the 1, or the higher level?
I don't know about all school districts. There are some school districts, especially in Middle Tennessee, that are using comparable metrics. But as we said earlier in that paragraph that Dr. Esslinger stressed, that is not the only.
Okay.
I mean, that is a consideration, but it's only one part of our consideration as we move from the different levels.
I know a lot of people have asked me about that because people are following numbers, and we all agree we want our kids in school. We've seen quite a few studies that have said place the kids in school, so that's going to be a discussion. If we're at those numbers, we could still end up in school.
That's correct, because there could be hot spots. I mean, if Fairview has an increase, that really doesn't impact the Franklin Special School. That doesn't mean that we don't have employees in Fairview, or there may be nursing homes that have hot spots where it increases and causes that. So I think you can't use, especially for us in a smaller geographic area, we have to consider those other things before making a decision whether or not we're going to keep students at home. We have to look at all of those things in comparison, and not just, as a group instead of solitary.
Okay, but that is not a determining factor on its own.
Right.
Okay.
Yeah, I think it's a good, a good idea, as you're doing here, to emphasize that additional level of discernment, because I think people tend to focus on just those metric numbers. So if in our discussions with stakeholders, we emphasize that additional level of discernment, I think it would be in our best interest.
When we get to those numbers, it triggers the systematic review, and that systematic review involves other data and other entities to make the decision.
I like what you said there, that it
Good.
triggers
Glad
the
you like
review.
that.
I like that, because presently we're at that number. And so it's reassuring to know that it is still possible for us to start school. In the building.
Absolutely.
Okay, anything else in that section? The next section is in relation to MAC, and MAC is pretty much going to follow is following the same protocols laid out by the schools.
I have a question about MAC. If for some reason we had a review of the numbers, like Alicia just said, and we had students at home, would MAC operate more than it currently does, or would MAC just shut down at that point too?
I don't see MAC shutting down. I see them possibly continuing with their 10-to-1 ratio that they do now. They have small group supervision now that the groups do not intermingle. They're in their cohort all day, every day. They eat together, but they will be under the same protocols as children in school.
And how has that gone this summer?
Very well.
Which is good.
It's been very well.
The other thing that I will add is that if we reach the moderate or substantial stage, and if we have the employee pool where we can have more students in MAC, at this point we're operating, I believe, capacity is 80, Dr.
Yes, sir.
Essling. But if we have the number of employees needed to keep that 10-to-1, then we could, and the employees to do that, then we could open up additional sites, because as you saw, in moderate and substantial, there'll be students on campus, but there still should be ample space to have MAC operate, again, going back to the pool of employees.
One more question. Would it change the moderate to substantial review if we have quite a few students whose parents already have them at home and we have smaller amounts here? Would that affect the decision we would make if we're already in smaller classes? A decision we would make to have more students home, or do you anticipate that?
I think that would have to be a consideration,
Okay.
but I don't think would be a total driver of that decision.
Any other questions regarding MAC? Okay. The next section, we're just going to flip through there. The table that's entitled Franklin Special School District Illness Guidelines During COVID-19. So this table, I believe it's the one previous to that. There, yeah, that's where we'll start. Yes. First of all, I want you to know that this table has been submitted and has been reviewed and approved by Dr. Michelle Fiscus, the medical director of the Vaccine Preventable Disease Immunization Program for the State Department of Health. So it has that approval, and we feel good about the protocols that are laid out here. In sections 1 through 6, those are status quo for a school year. They have not changed. So let's look at the last 3 sections of this table. The first one that is entitled Symptoms of COVID-19. So this table breaks down the topic on the first column. You should not attend school or work. So this is a document for staff and students to reference, for them to have guidance on what to do if. So we should not attend work or school in the second column, and you may return if and when is captured in the third column. So we'll look at the symptoms of COVID-19. If you have 2 or more of the symptoms listed there, you should not attend work or school, which are pretty much covered by the questions that will be asked every day. And you may return when 10 days have passed since the symptoms first appeared, symptoms and fever-free for at least 72 hours, without the use of fever-reducing medication or a doctor release. If an individual has a positive COVID test result, so you may not attend work, of course, or school with a positive diagnosis, and parents or guardians must notify the school immediately upon receiving the positive test results so that we can begin contact tracing procedures at the school level. You may return when and if 10 days have passed since the symptoms first appeared, fever-free for 72 hours without fever-free medication, 2 negative COVID-19 test results at least 24 hours apart, plus symptom-free for 72 hours. The next one is one that has come up already in our district: known contact with a person who tested positive or has probable COVID-19. So if a person is exposed, and we define what exposed means. Exposed means you were within 6 feet or for at least 10 minutes, or live in the same household of a person with known or probable COVID-19 from 2 days before their symptom onset or positive test result. You must notify also the school and consult your healthcare provider, and must quarantine to return to work or school. You would quarantine for 14 days after the last exposure and no symptoms have developed. Okay, moving on to the last section of this part of our Return to Learn plan. This is our response plan to a reported positive case. So if we have a reported positive case, each school building will have a designated COVID-19 response coordinator. And right now we're considering the school nurse that response coordinator. Staff and parents will be educated in the importance of promptly reporting a suspected or confirmed case of COVID-19 or known exposure to someone with a positive or probable COVID-19 test. And of course, HIPAA guidelines will remain in effect. All staff and parents will be provided the FSSD illness guidelines, which we just reviewed, and these guidelines will help direct parents and staff on school health protocols in the event of whatever situation was in the first column. All reports of positive COVID-19 cases, whether self-reported or reported to the district by the local health department, are directed to the COVID-19 response coordinator, who will promptly notify the district COVID-19 response coordinator, which is our district nurse and our district supervisor of safety and security. And they will then notify Williams County Health Department, school principal, and director of schools. The district will begin to assess the situation by identifying the potential exposure contacts and the building areas affected. COVID-19 response coordinators will help notify staff, parents, students, and/or visitors who were identified as potential exposure contacts and what next steps should be on their part. All areas of the building that were impacted by the positive case will, of course, be sanitized and will be closed until full sanitation can be done, per CDC guidelines. The need to close school or a building for contact tracing, sanitizing purposes, or due to multiple reported cases within a school will be determined by the director of schools in collaboration with local public health officials. Any questions regarding our response or thoughts around that? Yes, ma'am.
Okay, so what you just covered there, the need to close a school or a building. Do you guys anticipate every single time someone in the building tests positive that we're going to have to close for a day, or?
No, it's all dependent on the situation.
Okay. And is it, so it could be closed though potentially for just a short amount of time and then reopen, or it could be closed for longer? We really depends on how much.
Ms. Fisher's in the audience. I'll reach out to her. But it's the variables of the information that were received. When the last time the child was at school or the individual was at school, when their positive case was, how long there's a lot of the variables that the people that surround Dr. Snowden will provide input, and we'll make that decision based on a case-by-case basis. Ms. Fisher, you want to address any of that?
Sure. For example, if there was maybe a case detected in a certain classroom on the 3rd and 4th grade hallway, what we're attempting and what we'll be working diligently to do, number one, is educate our students, our staff, our teachers, everybody on the importance of distancing so that we don't have multiple contacts. The less contacts we have, the better, okay? So if we have an identified case, and we are also cohorting, we're really trying, this kindergarten class doesn't mix with this kindergarten class. So the only exposures, are going to be in that one class. That classroom would be shut down. Anybody who's deemed to be within the 6-foot radius for 10 minutes or greater would be in quarantine. So it could be the whole class, okay? It could be the whole class and maybe a music teacher if she was not distancing well or whatever. So it could easily be one wing of your building, one room of your building, one class, a few people. So it'll vary greatly. But it all will be determined about how many contacts you have and where they've been.
I like to hear that there's possibilities to keep other students
That's why we're
consistent
really
and learning.
And cohort, it's going to be obviously easier in lower grades. Cohorting is a lot easier than it will be in our older grades, but even there, they're just, any strategy they can have to prevent mixing of students will be happening.
Great.
Okay.
I do have one more question. I kind of think I know the answer to this, but I want to just kind of throw it out there anyway. Right now, I'm getting the impression just from other people in healthcare and people who have been tested that the results are taking a long time when you go to the efforts at the Ag Center. Okay, I've been asked if we're going to provide any testing or if we're just going to ask people to go to their primary care or a walk-in clinic.
I think I can answer that. Okay.
I'm glad you can answer that.
Yes, you're exactly right. Those testing results at some physician's office.
We can't provide testing.
Most of the cases that we know about in some of the areas are being self-reported because it may be a week or two before you hear from the health department. And that's why we will start we will be contact tracing within the building. And the Department of Health has approved those guidelines that we'll be following to identify those contacts and exclude them in quarantine. Okay, so we're working under their direction already. No testing is required, okay? Because If you call me and you say, I was quarantined, but I had a negative test today, doesn't matter. Your quarantine period is 14 days because you may have tested negative at day 8 and you may be symptomatic at day 10. The quarantine period is set at 14 because that's where they think somewhere in that 14 days after exposure, you may test positive. So just because a negative test does not get you back as an exposure. Now, as a person who's already been diagnosed with COVID and you're at home, your return to school, one of the criteria you can use would be those repeat 2 negatives at least 24 hours apart. That's not required. What's required is the 10 days from your symptoms and fever-free for 24 hours to return. I know it gets kind of confusing, and that's why we will be training all our COVID response coordinators carefully, in that respect. But really, a negative or a positive test really doesn't come into play when the exposure. Like, I was exposed, but I've had a negative test, I'm ready to come back.
Let me add something to that too. So on the call, I listened in to the 3 p.m. conference call with officials across the county that I listened to, and the representative today for the health department, the EMA director, was speaking for her, and he said that a lot of the frustration with the delay in the results of the testing has been the lab they've been using. So they have changed to a different lab. So that's part of the reason they feel like some of the numbers are rising right now, because the test might have been done 15 days ago, but they're just now getting a result back. So it doesn't necessarily mean that there's all these more people out there that are affected. They're just now finding out they were. So the lab has been changed. And I will tell you too that the numbers of people that were getting tested at the Ag Center has gone from 1,000 a day to today they tested 554. So that's changing as well. But the lab has changed that the state is going to use for those tests, and so they're hoping that that will improve the response time for the COVID tests.
I do also want to, and this is really for everybody, but may it be said over and over again, thank you and thank you guys, because this is a big job. And taking on that kind of responsibility on reporting of symptoms and quarantining, that's a lot. But I thank you for doing what you can to keep our children and teachers and employees safe, and to keep them in an educational environment learning.
I have a question.
Yes, ma'am.
My question is in reference more to before you were responders, you were nurses. And for the multiple kids that come in with myriad symptoms outside of COVID, are we having additional stations, or just because your nurses station seems like it's going to be...
Well, there is an isolation room. Every school and every building, we are required to have an isolation room. Okay, so if I have a symptomatic student, they're going to the isolation room. Okay, they're going to be separate from my kids coming in for their regular medicine care or diabetic care or whatever. And so that also will look different at each school, the location, how it's monitored, and all that. Hopefully it's for a short period of time till a parent comes. And that's a kid, we're not going to know if a kid has COVID. If they have COVID symptoms, they are in the isolation room. Okay, because those symptoms alone exclude them from school for that period, unless they return with a doctor's note giving, indicating alternative. It may have been strep throat, but I don't know that. Because maybe it was and maybe it wasn't, because they'll go to the doctor and get tested for probably both and end up with strep maybe, okay? So, but we're going to assume, if they have 2 or more COVID symptoms, we're going to assume that they could be COVID, so they're going to be isolated.
Thank you.
Okay, and the nurses will be wearing some personal protective equipment, because we will be in closer contact with them. So we'll be following a little bit different guideline. We won't be quarantined every time we've been with a sick person, because we are going to have some, medical grade masks and gowns and such face shields and stuff when dealing with those patients.
Do we have enough of that? The
yeah.
PPE?
Well, we will by the time, we've got some, and Yeah, it's becoming more available, okay? But there's like a level 3 mask which you'll be using that's not necessarily N95 that you hear about.
And as far as PPE goes, that's another huge advantage we've had in our county as far as the relationship that we've got with our health department and with our emergency management. So I'll just speak to some things that I've been able to get, I shouldn't say I've been able to request and they've been able to provide. So the state gave us 10 thermometers for every school. We have almost 4,000 cloth masks that were donated by the health department. We had a request, I put a request in last week for 40 disposable masks per student. So that way we have multiple disposable masks. And then over the summer, I know Ms. Fisher and I have delivered multiple cloth masks like this that people are voluntarily made. Plastic face shields have been given to us by the state. So I put in a request. I said I want this many for every school, and they were delivered to my office at the safety building within a week. Hand sanitizer is in great supply a lot because of them and because of what Mr. Sternberg has been able to get, as well as gloves. So I get emails from emergency management on the regular saying, how are y'all with your PPE? Do you need anything else? Keep us posted and let us know. So that's been a very, very good relationship for them to check in with us and pop up in the office, and say, how's everything going? Or I'll go into the office and there'll be more masks just on my desk that I'll bring in and hand out. So that's been huge. That's been huge.
And Williamson Medical Center, y'all may not realize this, but every year they generously donate to our clinics. They pretty much supply all our Band-Aids, our gloves, our thermometer probe covers. These are expensive items that we would be paying for. They have been very generous over the years. This year I have requested some additional personal protective equipment. I don't know if they'll have it available. They were meeting, I believe, today to consider my request, and they'll give us whatever they can. So they're another very generous partner that we have.
And I'll add to Lipscomb's engineering department has a faction of the department that's a nonprofit, and they do nonprofit projects. They have shifted to cutting out with a laser, cutting out forms and building face shields for primarily healthcare workers. We've reached out to them. We've ordered 150 face shields for a donation to their GoFundMe, but they're also working on 1,000 face shields for Metro schools. So they're a little busy group of guys cutting out face shields, but we do have our supply, and they'll be here in a few weeks.
I have one more question. And I know this is sensitive in nature. For our families who generally spend time out of state for work over the summer, our migrant workers, and I know we have international families that will visit. It's such a touchy subject, but how are we providing communication to them? I don't want to put them on blast, but at the same time, just again reiterating being outside of the country, as well as the being outside of the state, and just the contact tracing with where the state was that they spent the lion's share of their summer.
I don't believe there's requirements for going outside of the state regarding coming back in.
Well, maybe just because of the hot spots, Florida being
Well, I was in Florida last week, so I don't know what to tell you about that.
It's such a touchy subject, but
I don't know about
I think we still have to ask the questions.
Yeah, they still ask the questions. They're still screened every day.
Yeah.
Is that the communication you're referring to? Well, they will be communicated with through Skyward and through the regular route of communication we're using through our Blackboard Connect, but they'll also be screened every day as a child who didn't travel. I don't believe there's requirements, Ms. Glass?
I was just going to say that I feel like I know whenever all of this started, that was why that was such an area to focus on as far as where they had traveled, because it originated, we think, not here. Well, now that it's here, we're just going to screen and monitor everybody like we always have. Doesn't mean we can't ask the question, and we can definitely, talk more about that if you'd like us to, but as at this point, we know it's in the county, we know it's in, Tennessee, we know it's in the U.S. as opposed to where it started and potentially started in China or wherever it was. And that's why we were asking those questions, right? More so at the end of last school year. So now it's more of just screening everybody, monitoring everybody, and keeping that communication open. Does that help?
Yeah, it does. And I mean, it's not just, more of our lower income families. I mean, it's our wealthy families who are getting their last trips in too, so, but I just, again, thinking through that extra communication.
Makes sense.
I had a question. This is great. I love that we're looking at all the possibilities, not just one cookie cutter for every case, but everywhere we go now, when you are interacting with someone, they have those plastic things that hang down. And I know one of the things we're concerned about is staff. At least that's what we read about. Staff are more vulnerable than children. Have we thought about
Yes, we have.
in classrooms? Was that where the teachers can be behind it? I mean, I don't know.
In classrooms, we're pondering that. We already have them made for offices.
Okay.
And for every encounter for the office staff, we have the barriers built. And for MAC will be built as well as for each office area and whatever area we need to. Our maintenance crew has patented their version of the Walmart barrier.
I saw one the other day. It was like hanging from fish line, and I thought
it'll be better than that.
Yeah, and I thought you could stand behind that, and that would just be another barrier. I didn't know if we were thinking about that for classrooms, especially the upper grades where there's going to be more migration of students. I don't know. I know you thought of everything, but I was thinking about.
We have not thought of everything. I can guarantee you.
You thought of everything.
But it'll also be like in a space like this too, right?
Sir?
Will they also have the plexiglass in this space like this?
Yeah, we can. There'll be other areas that would justify a barrier such as that. So yes, we have. Have we identified all those spaces yet? Probably not, but we have the capacity to put that together. Okay, that concludes operations. Dr. Snowden?
Dr. Decker, starting back on page 2.
Oh, I'm sorry.
Good evening.
Good evening.
In a similar manner as Dr. Esslinger, I will highlight some key items, but of course, if you have a question or comment, please stop me. So first, we're going to look at scenario 1, in which most students will attend school in person. This would be in the case of the minimal county spread of COVID-19. Most students would attend in person, but parents can make the choice for their students to have virtual learning. We will follow guidance from the Tennessee Department of Education as to how attendance will be coded for students who are unable to return to school or whose parents choose to not send them to school. We are waiting on that specific guidance. We will update it as soon as we have it. For the instructional technology section, I'd like to highlight, if you would look down at the third bullet, that all students in grades K through 8 will be one-to-one with a device. Students in grades K through 4 will be able to take home those devices once a week, Monday through Thursday, at the discretion of the school administration. Students in grades 5 through 8 will take home their devices on a daily basis. We will provide cases for those in which those devices will be transported. Virtual students will check out their devices from their assigned school and should communicate with the school if they have technical issues. We are also committed to providing internet connectivity for all of our families. During the first week of school, we will reach out to ensure that families have internet connectivity. If they do not, we'll work with them. Schools will work with families that need support in this area. Students' use of devices will be monitored through Go Guardian. That's already in place. It's a system designed to help keep students on task, safe, and away from inappropriate content. And of course, we will have sanitization procedures in place for devices. Students in grades K through 2 will have Chrome tablets. In grades 3 through 8, we'll have Chromebooks. Any questions with regard to instructional technology? Okay. So we will move on to work expectations.
Actually, can I interject just in case someone's like turning on our live stream now?
Absolutely.
Do you mind saying that we could be at the 0.5%, but yet still running on this, just for clarification?
There will be various metrics observed
Thank
for
you.
the decision. Yes, thank you. So if we could move to page 3. As always, teachers will follow our district pacing guides. An important point here is that those pacing guides have been revised. Some are still in the process of completing those revisions. They'll be completed shortly. They've been revised by teams of Franklin special teachers to address key missed standards from the March through May closure of 2019-20. Teachers will prepare substitute lesson plans, and they will be stored in a shared Google Drive so they can be accessed by school administrators or teachers' team members. And as you're aware, we've had a focus on district-adopted high-quality resources for quite a while. Teachers and paraprofessionals will continue to use those district-adopted digital resources regularly, primarily to provide a guaranteed viable curriculum, but also to prepare for a potential all-virtual learning scenario. Those district-provided digital resources were something on which we were able to depend quite a bit during the extended closure that we had last spring. Select teachers who are unable to return to work may be selected to provide virtual instruction for those students who are unable to return to school or whose parents choose to not send them to school. We then have some specific considerations for special education teachers, English learner teachers, related arts teachers, and teachers of honors classes, because there are specific procedures or changes, adjustments that may need to be made in those areas. Questions around work expectations? Okay, we'll move on to instruction on page 4. It is a state requirement that the district develops a COVID-19 continuous learning plan, a CLP. We're in the process of completing that now. It's due to the state at the end of next week. The CLP will include many of the pieces that are in this Return to Learn plan that we're examining tonight, as well as additional evidence and artifacts to show that not only are we addressing those missed standards from the end of last school year, but that we have a guaranteed viable curriculum in place for all students, whether it's virtual or in person. We'll also ensure that there are opportunities for accessing instructional materials, whether it's downloading remote instructional materials or collecting materials at school. As always, instruction will support learning growth toward mastery of the Tennessee academic standards. And to reiterate again, teachers will determine learning gaps that may have occurred due to lost instructional time in 2019-20 and will attempt to fill those gaps. Foundational literacy is already a focus of ours. It will become even more so. It is even more so, as well as conceptual mathematics foundations. We may need to adjust instructional time and support to extend literacy blocks and mathematics blocks. And teachers will make assignments available in Google Classroom for students who attend school in the in-person setting and for whom an extended absence would be necessary due to COVID-19 exposure, symptoms, or a positive COVID-19 test. Absolutely.
You may talk about this when you do talk about virtual. Like if they are students that decide to stay home, maybe you'll go over this later, how will we determine the learning gaps at that point?
We will administer the same diagnostic assessments to those students that we do to the students who are in the in-person setting. And we have a variety of ways that we can do that.
Hey, Dr. Decker?
Yes.
Look in your crystal ball here for just a second.
Okay.
Do you see this point in time and what we're facing now to maybe be the start of a fundamental shift in how we deliver educational services on a going forward basis? In other words, always having the option of in class or online learning available at the parent choice. Tough one, I know.
It is. You know, I think what I do see, going back to those high quality instructional materials, especially the digital resources, I think that we saw in the first extended closure how key it was to have those ready to go and to have them easily accessible to students and parents. So I think that has come to the forefront even more. And then of course, we are now one-to-one with devices for students in grades K through 8. I think that that's something that we'll work to sustain as much as possible. So I think that, you know, this situation has, again, brought to the forefront things that we knew were important, have become even more so.
Okay.
I do have a question, please.
Yes.
Okay, so if a child is at home due to quarantining and just are monitoring symptoms, that child will not necessarily hop onto virtual learning. They will be given specific tools from their teacher to do online. Is that correct?
Correct.
Okay.
It'll depend on the specific case, the length of the absence.
Okay, if it's a longer absence, can they hop on to virtual learning? Can they transition that way?
They can.
Okay, thank you.
That's part of the advantage of having Google Classroom. It's something that's used all the time anyway.
The only problem with that we can foresee is that, you know, you may have that child may be in Ms. X's class, but virtually they're taught by someone else. So they wouldn't just jump onto the virtual learning that's different from their teacher. Their teacher could use or will use the same virtual resources that people who have signed up and are using virtual learning. But they wouldn't swap teachers. They would continue with the same teacher because we expect them to return to school once they become symptom-free. So if you jump completely into just the virtual and had to change teachers, we don't think that would be fair to the child at all.
Then is the main teacher is that teacher responsible for that communication and contact on a regular basis with
Yes.
the family? Okay.
And again, that's something that can be facilitated through Google Classroom, which will be happening when the student is in school in person, no matter what. So that foundation's already set.
And there will be parent training on Google Classroom and how to make sure you get some of those communications too as a parent?
Yes, that's
Okay.
coming. That's in this document.
Very good.
Yeah, I mean, I'm sitting here thinking, this is great, except we're leaving out the part of the virtual or online classroom. The student is at home, and we don't know if the student's going to be supervised at home or if the parent's going to make sure the student's on the computer or engaged. And are we going to talk about that a little bit, or is we just hopeful that if the student is at home, parents will participate.
We're hopeful.
If they can.
But we have
Some things.
We have bullets that mention teachers, if we go to an all virtual model, teachers holding a Zoom orientation for parents and students on accessing resources and training opportunities for parents. Okay, so okay to move on from instruction. Extracurricular activities, students enrolled in Franklin Special Virtual Learning will be allowed to participate in all after-school activities at their school, and of course, we'd have to look at a case-by-case basis and make sure that all of our safety protocols are in place. Communications. Let's move to page 5, please. The district will provide a variety of online community resources as we do typically and as we did during the extended closure in spring of 2020. Various resources for families. We have created and will update as necessary a school/district-based information sheet to advise personnel of guidelines, reopening procedures, and associated health and wellness protocols. Much of that is in this document, of course. You've heard from Dr. Esslinger. The COVID-19 webpage that is a part of our Franklin Special website is being transformed into an information site with back-to-school information, resources, guidelines, and updates included. And messaging templates are in the process of being created, both email and phone, for likely scenarios that we may encounter.
Is that COVID webpage also available for the app?
I believe so. Okay. All right, we'll move on to assessment. So as a result of the extended closure in spring of 2020, the state is offering an optional start of year checkpoint assessment for grades 3 through 8 in ELA and math. It's designed to be done in the classroom. It's computer-based, will be scored immediately. It does not replace the universal screeners and diagnostics that we already have in place in Franklin Special. We are going to make this available to schools as an option because it does address potentially the learning gaps that may have occurred because of that extended closure. But we have so many other diagnostic assessments and universal screener in place in our district that we are not making it mandatory at this time. As I mentioned a little bit earlier, students who receive virtual instruction will be administered the same common assessments as students who attend school in person across all content areas. And that concludes the teaching and learning portion of scenario 1.
I just have one petty question regarding loss of their a child who has some type of damage to their tablet or computer. How did we work that out when we were doing remote learning in the spring with unique cases? I just remember from the budget you were referencing if we had extra cords for the kids, it would have cost X amount of dollars. And we had staff that came in and just got everything together so that we could make that an option for our families. Again, the crystal ball question. Yes.
I think it is referenced somewhere in the plan that they would contact the school and then the school will provide technical support for any device that is damaged or is not working properly.
Okay.
And to add to that, on the front end, all students and parents will sign the network and internet user agreement and the student expectations for Chromebook and tablet use.
A quick question, I may have missed it, under the work responsibilities, are we, if we have a certain number of parents who decide to do online the learning, even if we're open and have students in the building, are we, I may have missed this, are we having certain teachers who that's going to be their only responsibility, is to do a group of, let's say there's 8 first graders that want to be online? Are we having a teacher assigned to that group, or how are we doing that? Did I miss that, or did we talk about it?
We're looking at that plan right now. First, we'll determine exactly how many students will be virtual, and we'll go from there.
And did we pick a date on when, was that in another certain time that parents have to decide about that?
After the board approves a plan on Monday, then we'll send out information to parents and have them have an opportunity to tell us if they're going to choose a virtual model, and also sign the agreement. And we're asking them to let us know by no later than the following week, so that we can assign teachers. At this point, we don't know how many kindergartners will be virtual, how many first graders, or any grade. So it's going to be important for us to have that information so we can begin the process of assigning teachers to those virtual classrooms.
Are teachers being asked if they're interested in that?
They will be asked once we determine how many are needed.
Thank you.
And you may have sent that out, but I'm sorry, are they making that decision based on a 9-week basis or a semester basis, or 1 or 2, how are we doing that?
I'm trying to remember. Cindy, I know we talked. Semester, yeah. We're asking them, and the reason we're asking them to commit to a semester is because of just what I said about the personnel.
Right.
Because if we got people coming and going, or going and coming off of virtual, then there's no way for us to, or it makes it very difficult for us to assign teachers on a regular basis. So if we have it for a semester, then we can do some better planning with personnel.
Yeah, I think that's a good idea.
All right, are we ready to move to student, staff, and family support? We're still in scenario 1. Most students attend in person. We're on page 6. Trauma impact support. As you're well aware, social, emotional, academic learning is part of our strategic plan through student advocacy. It's been a focus in every one of our schools for quite a few years, and we understand that it's become even more necessary to focus on those strategies. School counseling plans will reflect the current need to address COVID-19 related social emotional learning and trauma-informed practices for students, families, and district personnel for the upcoming school year. And of course, we work closely with coordinated school health, school-based mental health liaisons, Family Resource Center, the school nurse, McKinney-Vento liaison, and community mental and physical health agencies. In a related piece with regard to student programming, the schools will maximize and enhance their existing social, emotional, academic learning practices and strategies. When we get to the professional learning component, we'll hear a little bit more about exactly what type of professional learning is being offered this summer and beyond with regard to social, emotional, academic learning. Also under student programming, clubs and fine arts groups may continue or resume when safety and social distancing protocols can be implemented, and sports may continue or resume at the discretion of state guidelines and or conference requirements. Those are also ever-changing guidelines, as I know you're aware. And then this is what we just talked about a little bit earlier under family support. In the event of an extended closure, the district will provide opportunities for training in the various digital platforms that students will utilize for virtual learning. Questions around student, staff, and family support? Okay. Still in scenario 1 on page 7, professional learning. Ongoing throughout the summer. In fact, there was an instructional technology session just today. Teachers and paraprofessionals and administrators have been participating in professional learning to become even more equipped in the daily use of our various digital resources, whether students are attending school in person, and also to prepare for another completely virtual learning environment. Digital resources on which we concentrate include Google Classroom, Zoom, Screencastify, Flipgrid, of course the digital components of all of our district-supported resources. As you know, we just had a new ELA adoption, so our educators have been working hard to learn all components of those new textbooks and resources. The instructional technology specialists will continue the building level instructional technology leaders program, and we anticipate that we will find even more and increasingly impactful ways that these educators can help support. Of course, we will address the social and emotional needs of students. We've had several professional learning opportunities this summer. Those will continue. I don't see those ending. Those will be ongoing. And then this is key. Teachers will be provided professional learning on additional ways to connect with students in a non-digital distance learning environment, such as written instruction, academic feedback, etc. And then as needed, support will be provided to teachers to help with data analysis, entry or benchmarks, progress monitoring, and of course support for intervention and remediation. And that will happen whether students are in person or learning virtually. And then in the social emotional learning section, you can see some of the specific professional learning opportunities that have been provided this summer, will be provided before school begins, and we'll have more as the year progresses. And that concludes scenario 1 for teaching and learning, student, staff, family support, and professional learning. Any questions before we move to scenario 2?
I'm really grateful for the synergistic relationships we have in all facets. I mean, going back to even what Selby does with the community, I mean, we've needed them before, but we need them more than ever now. And so thank you guys for just having a record of excellence on that.
Thank you. In scenario 2, most students will learn virtually. As Dr. Esslinger mentioned earlier, there may be small select groups of students that attend school or attend class on campus. Those might include some special education students, students with IEPs, English learners, students who require intense academic and/or behavioral interventions, possibly pre-K through second graders. In a mostly virtual learning environment, each school will take attendance daily. Teachers will take attendance for each virtual class using a variety of metrics. Those could include, for example, a work product, a completed assignment, time spent in a digital learning platform. And again, once we have exact guidelines from the Tennessee Department of Education on how to enter attendance into Skyward, our student information system, we will share those. Work expectations. So in a mostly virtual environment, as we mentioned earlier, there will be a student/parent orientation held via Zoom on how to access our digital resources. Teacher teams will collaborate together at least once a week for 1 hour, and they will check in with school administration weekly. These meetings will take place via Zoom. There will be a shared virtual master schedule created by school administration with input from teacher teams so that there are not conflicts amongst various Zoom meetings. With district and school administrative support, teachers will create a daily schedule that will establish the frequency and duration of those class meetings as well as student expectations. The next 3 bullets I'd like to emphasize because this requirement around access to instructional time in each school day is one that comes from the State Board of Education. For students in grades 1 through 8, they will have access to 6.5 hours of instructional time each school day. For students in kindergarten, it will be 4 hours, and for students in pre-kindergarten, it will be 4.5 hours.
Are you going to explain more what that means later? Okay.
I will. I'll state now, and I'll come back to it later, that does not mean 6.5 hours in front of the screen. There will be a variety of different learning experiences that teachers will direct students to complete.
Will teachers be engaged that way?
There will be times when students are doing independent work that they'll be able to plan, that they'll be working perhaps with smaller numbers of students. So it will not be a continuous 6.5 hours. And we have sample schedules that we'll reference at the end of this document as well. Each paraprofessional will be assigned to a teacher team and will participate in the collaboration with that team. All the job duties of each paraprofessional will be in support of the team to which he or she is assigned. We want to make sure to communicate very clearly with students and parents, so they will be provided with an explicit syllabus. Some of the items that the syllabus might contain would be rubrics, deadlines, expectations for engagement, due dates, grading expectations, and so forth. Yes, sir.
I already know the answer to this, but I want to ask it anyway. Translators are engaged in this process so that any language needs from roughly a third of our student population can be addressed?
Absolutely.
And I have a question. How are paraprofessionals going to be involved on a daily basis? How are paraprofessionals going to be utilized besides with the Zoom meetings? Will they be interacting with students then?
Potentially.
Potentially based on what their teacher needs?
Exactly. It'll be under the direction of the teacher and the administrators. So we are, if we're okay to move on, we're at the top of page 9. Teachers will be available for instruction, feedback, support. Those will vary in time length, but it'll be during typical school hours, Monday through Friday. Paraprofessionals will also fulfill job responsibilities during normal school hours, Monday through Friday. The fourth bullet is key, so I want to make sure to highlight it. Teachers will teach new content. That is not something that occurred during the extended closure in March through May 2020. Teachers will assess virtually. Professional learning has been and will continue to be provided. Teachers will assign grades, and students will upload their work to Google Classroom. Teachers will provide a combination of real-time lessons via Zoom and pre-recorded lessons that will be accessible on demand 24 hours a day to be pushed out through Google Classroom. Again, we will place emphasis, as we always do, on our district-supported resources because they are high quality and have been shown to impact student achievement to a great degree. Teachers will provide parent support and will answer questions and emails within 24 hours, Monday through Friday. Teachers and paraprofessionals, as we mentioned in the earlier scenario, will continue to engage in professional learning. If we are in an all virtual learning scenario, the district will provide and suggest virtual professional learning options. So we'll move to page 10 unless you have other questions.
I just have a question. Obviously, we want all of our kids in school. That's everybody's priority. I see all this, and I think that's amazing what teachers are going to do, but you have to have a parent there making sure the student's doing it. And that's my biggest concern. Parents could be home working. Kids are going to, I guess we can't, are we even thinking of ways that we can address that, or you think it's just going to be through communication with parents, this is what we have to do? I've heard from so many parents who are worried because they're also working and having Zoom meetings, and they're at home, and if they're home, and they might have 3 kids, kindergarten, second, and fourth, and I'm just so concerned about that.
I think absolutely communication will be a big piece. I think having the pre-recorded lessons available will be helpful because we know that not everybody will be able to participate in real time, so we hope that will be supportive. And then I have to keep coming back to our district-supported resources. For example, iReady Math has personalized paths for students to work in that they're used to doing that here in school. So that's something that can translate very easily. So I think it's something we'll have to be continually on top of and continually communicate about, but I think we have so many resources in place that we're well equipped to handle it.
So learning technically could be done kind of asynchronously.
It could.
Because it does make everyone stay long, but when a parent is home after work, then they could make sure some of the other things are done. And I know that's not ideal, but there are options.
Absolutely.
One thing that I was thinking of, I guess we're highlighting areas of our concerns. One being, I know that some people are so hyper-focused on wanting their kids to be at home. But once they get into the rigorous aspect of this, they're going to quickly realize the kids needed to be in school because they're not able to keep up. And I know we have plans in place. I'm comforted just knowing that we're going to help walk parents through some navigation in areas like that.
Definitely. And that's something, we don't have an end date on that.
Yeah. I mean, just the simple thing of when we first started with this in the spring, helping people understand your child needs to be on a schedule. And what does a schedule look like? Just like you're on a work schedule. I mean, just that aha moment, of doing things like that for families that, just for families, so.
On page 10, we also have specific considerations we wanted to be sure to delineate for special education teachers, EL teachers, related arts teachers, and I'll just touch on a few of these. For special education teachers, they will provide students with disabilities access to instruction in a manner consistent with each student's IEP or 504 plan. This may include, and we've mentioned this earlier, socially distanced on-campus instruction as appropriate. English learner teachers will also provide students access to instruction in a manner consistent with each student's individualized learning plan and with State Board English as a second language program policy. English learner teachers will also record and provide virtual lessons that will be available in real time or obviously in a recorded manner. Related arts teachers will collaborate across schools, and they did this during the extended closure in the spring. They'll collaborate across schools to share best practices and lessons, ensuring the highest quality instruction in all areas. They'll provide lessons to the school community, and they'll support instruction in the school community by maintaining contact with families in a variety of ways.
Dr. Decker, we've always had a very strong related arts program in the FSSD. And I would hate to see that being lessened in any way. And related arts is hard to teach virtually. How do you have a band concert? How do you explore physical education? You want to pull out that crystal ball again and maybe talk us through some of those things?
Absolutely, sir. And You know, I had the pleasure of working closely with the related arts teachers when they developed plans for that extended closure that we had that began in March. And I'm happy to send you some samples if you'd like to see of the plans that they came up with for students to do, for example, an at-home physical education program. On Monday, do these exercises. On Tuesday, you know, do a certain amount of running in your neighborhood if you're able to. That's just PE, for one example. We have a digital music program, Quaver Music, that is very engaging, is very tied to the typical musical instruction that teachers deliver on a daily basis that we're able to use. We used it before, we can use that again. These teachers, the related arts teachers, are able to collaborate across schools so well and develop plans for ways to address the standards at home, whether it's music, art, physical education, that I have every confidence that they'll be able to do it again.
Okay.
I have a question, and maybe this isn't the right time to ask, but we're talking about this scenario too where most students learn virtually, but we also have in the packet that some students might be at school, and would that just be determined by a school-by-school basis or as-needed basis, whether it's English language learners or special education students or behavioral, or, I mean, is that going to be determined, like we would, I guess I'm trying to figure out how we would decide who would be in school if most of our other students were virtual learning.
So these are the students that we would prioritize because of their greater needs. And yes, it would depend on the situation. It could be on a school-by-school basis. So as we move to instruction, if I might ask that you skip ahead to the end of the packet, to page 27, we have sample virtual learning schedules for both elementary and intermediate middle schools. And again, we reiterate here that this requirement for access to instruction comes from the State Board of Education. And it does not mean 4 or 6.5 hours of continuous online screen time for students. It could also include, for example, math fluency practice, online teacher conferences, potentially telephone conferences, individual reading and writing assignments, project-based learning. Those are just some of the examples. Now, again, these are sample schedules. They can vary from school to school and grade to grade, but it gives you an idea of how the day might be broken down. And that a teacher might assign lessons from a district-supported resource around ELA or math, and then might have a live Zoom meeting that would also be recorded, so the students who couldn't participate live would be able to see it later. And then they might assign some independent reading, and that's just the ELA block. So the schedule on page 27 is a sample elementary schedule, and then we have on page 28 a sample intermediate middle school schedule. And you'll see that we reference heavily our district-supported resources.
Assuming that most of these that say like teacher assigned lessons for social studies, teacher assigned lessons for science, since we're going to be teaching new content, there would have to also be teacher recordings or Zoom meetings with the classes to actually teach the content before they assign the lessons. Correct?
It would. In some of our resources, they might be able to assign first a video or a passage, and then based on that learning, they could follow up with instructions. So it could be either way.
Either or. And are teachers going to be utilizing the buildings if we were virtual, or will this all be from their own personal residence, or will teachers be in here collaborating, or if they're doing virtual?
Again, it'll depend on the circumstance. Okay. It'll depend on if there's a stay-at-home order, for example. Mm-hmm. Okay, so if we could go back to page 10, and actually we'll flip right ahead to page 11. I wanted to emphasize again that teachers will determine learning gaps that may have occurred last spring. And foundational literacy in mathematics will be emphasized. The last bullet under the current section, instruction, I wanted to emphasize this as well because I talked about it earlier from the teacher side, but I wanted to make sure that we made apparent students will earn grades that will become part of their permanent academic record, and they will receive report cards.
Okay, I have a last magic ball, since he's been using that term question. How long do you think it'll take us to make up for the gap we had in the summer slide that we have at the beginning of the year? What do we think?
Well, I would say that the expectation is that we make it up by the conclusion of this coming school year. Mm-hmm. I'd like it to be sooner. But that's the mandate. Mm-hmm. Okay, extracurricular activities, same as in the other scenario. And then instructional technology, and we're still on page 11. We talked a little bit earlier about students being one-to-one with a device and the district working with families to ensure that everyone has internet access. Digital instruction, and this is not new, but just to make it apparent, all district resources will be accessed by students via the Clever platform to ensure copyright protection and ease of access. I think we've covered the rest of that section. Any questions on instructional technology in the virtual setting?
I do have just a comment, and
Yes,
maybe
sir.
a question will come out of this, but the thing about the digital learning at the kindergarten and pre-K level that concerns me the greatest is, many years ago now, there was a book, All I Really Needed to Learn, or Needed to Know, I learned in kindergarten. In kindergarten, you don't learn astrophysics, you don't learn higher order math. You learn not to bite. You learn your colors and things like that are just so rudimentary to how you learn in the future. How is that going to be impacted, and how can we mitigate raising students who stare into a screen all day?
Mm-hmm. Our teachers know the importance of relationships, probably better than any other educators I've worked with. And just listening to their stories and anecdotes about the extended closure that we had this year, they found ways to connect with students. And even if it is in the virtual setting, I heard sometimes it said, yes, we had an academic goal to accomplish in the Zoom meeting that we had, but really what was more important once we finished that academic goal for the day was to connect as a class and to hear how everyone's doing, and to talk about stories that needed to be shared. So I have confidence that our teachers know the importance, and our school administrators, of keeping those relationships alive and of imparting exactly what you're referencing. And I think also our district emphasis and focus on social, emotional, academic learning, it's really become, it's not something, to paraphrase a saying I've heard before, that we've put on the plate. It is the plate. So it's part of our culture.
Okay, thank you.
Also addressing that is, if you look back, remember as we discussed earlier about select groups of students, that's why our focus is, and our plan and our desire is to bring back to physical school those kindergartners, those first graders and second graders, because yes, can they learn virtually? they can. But is it better to have them physically in the building? Absolutely, we believe that. So even in a moderate or substantial spread, we believe there's a great possibility that we could have those students returning to the building instead of being completely virtual.
Okay.
So that's our desire.
Good, good.
That's what I was just going to ask, because I didn't know if any of the scenarios we had thoughts that we could have some groups of students, and preferably the younger students, like you just said, Dr. Snowden, who, from everything we've been given report-wise, are the least at risk to be in the building, because it is really hard to picture kindergartners, first graders, second graders learning all the things they learn at school, which isn't just reading and writing and math. It's so much more behavioral and social that they could be in a building even if other students were doing virtual, which of course 7th, 8th graders, 6th graders, they're more used to that. I'm not saying I wouldn't want them in the building either, but I would like to see the flexibility, as we've been talking about, possibilities. It's not just cut or dry who's going to be here, who's not going to be here.
Absolutely.
Can I just make a clarification point here? Just because I'm getting a message from somebody watching this stream, and I'm not trying to, it's not a controversial thing. There's some confusion on the use of virtual versus online. And so if someone chooses the virtual classroom for their child, that is good for a whole semester. And this tiered approach doesn't necessarily apply to them because they will be home and they will have an assigned teacher and are assigned classes that are all done virtually that whole semester. This tiered approach is for the students who start the semester in the school. And if we have to adjust attendance based on what is happening in our Franklin community, correct?
The different scenarios, yes.
Okay, thank
Correct. At the end of the instructional technology section, I just would like to highlight that, as always, the instructional technology specialists will provide professional learning and support for teachers around all of our digital resources, any online course materials, how students will submit completed work, and how to engage learners of all ages in appropriate content instruction through digital platforms. So again, this is something that we're constantly working to enhance. Communications is similar to what we heard in the other scenario. Just to reiterate that we understand how crucial clear, consistent, concise communication is and will continue to be. On page 13, assessment. We know that it's best practice to administer our universal screeners and diagnostics at school, especially with those particular groups of students that we were just discussing. But if not, we can ensure that those assessments are rescheduled or potentially administered remotely. And then, of course, students who receive virtual instruction will be administered the same or comparable common assessments as other students in their assigned school across all content areas. That is teaching and learning for scenario 2. Ready to move to student, staff, and family support. Okay. Trauma impact support is similar to the components that we have in scenario 1. But if we go to an all virtual environment, of course, we can address some of the social emotional needs of students virtually. Professional learning is and will continue to be provided. Under student programming, if feasible, clubs and fine arts groups will meet virtually, and athletes may be provided at-home conditioning plans by coaches.
Just a point of clarification.
Sure.
The only athletes we have within our middle school that coincide with Williamson County is color guard. Can you think of anything else? That's 8th graders, I think. Just.
I'd have to research that.
Okay. Just again, I know that they, they're already, they have a lot of rigorous practices with that in place for obvious reasons with TSAA. Thanks.
Okay, and then if it's all right with you, we'll move to professional learning for scenario 2 on page 15. I'd like to highlight the state requirements around professional learning because if we go to a virtual scenario, all state requirements for professional learning will be met. The requirement for teachers is 18 hours for the school year, and if we are in an all-virtual environment, teachers will fulfill this requirement by participating in virtual learning that is provided or suggested by the district. Paraprofessionals will complete their required professional learning by attending virtual training and several other options there, but it's all dependent on the assignments and approval of the administration at their school. And then the virtual learning pedagogy and support, we've touched on, I think, just about all of those. Again, a focus on district-supported resources, platforms to include Google Classroom and Zoom, pacing guides that have been updated. And then the various social, emotional learning, professional learning opportunities are reiterated in the last section.
Okay, I do have one question. For those families that do select to do virtual learning for the entire semester, will it look similar to what this scenario 2 would look like as far as their daily schedules and the possibility of some live but asynchronous?
It would.
Okay, thank you.
And that concludes scenarios 1 and 2 for teaching and learning, student, staff, and family support, and professional learning.
Thank you. I'll just, if I may, like to answer some questions that were received earlier. Number one, or one of the first questions that we have not addressed is substitute status. Our substitute, we use Staff EZ. They sent out a survey to 120 subs who were active with the Franklin Special School District. Of those 120, 50 have responded to date. They are resending and following up with the substitute pool to encourage additional responses to that survey. They're also working through July to recruit and train additional subs. So that has to be a concern at this point about the number being quite a bit lower than what we had on the list as of March. But again, we'll continue to work, and Staff EZ is continuing to try to recruit. However, recruiting people to come into an environment with the spread as high as it is in our community, I think is going to be challenging to say the least. But we'll continue to do that. Another question related to if a teacher tests positive for COVID or must quarantine, is sick leave covered for this? Can he or she still work from home if quarantine? Is the sick leave number changing? There is a policy that you approved back in, I guess it was April, May, but employees will have access to 10 additional days of leave due to COVID-related reasons. That's in the policy. I have attached the form that, or the form is not attached, but we have a form that employees will use if they have a COVID-19 related. If the need for absence exceeds 10 days related to COVID-19, employees are eligible to use their available paid time, whether it's sick, personal, or in some cases vacation for those who earn vacation, or take non-paid time if they do not have personal time available. The COVID-19 days can be requested through the HR department. Can a teacher work from home if quarantined? Would depend on the status of the classroom. Is the entire classroom going virtual due to a quarantine order? If so, the teacher would be able to continue remotely and not have to use sick leave at all. If the class will continue, there would be a sub placed in the room and the teacher would use sick time. Is the sick leave number changing? Employees are not receiving any additional sick leave added beyond the 10 days they earn each year. However, if the leave, as I said, is COVID-19 related, that leave, they have access to 10 additional days. Also, questions regarding that? Will we be kept to the same attendance standards by the state? As of now, absences for quarantine are to be marked as medically excused. This is for a child that is diagnosed with COVID-19 or a child that is being asked to quarantine due to exposure to someone with COVID-19. Guidance from the state is supposedly forthcoming related to that. A virtual learner will be coded as a D, which is a new code the state created. This means they count as present in the eyes of the state. Next question, has there been any determination as to testing at the end of the school year by the state? That's a great question. And at this point, we don't like the answer, but at this point, the state has not changed and testing is scheduled to occur. The superintendents are asking for testing not to occur for the school year and for districts to utilize their own metrics, their own benchmarking, their own diagnostic tests. But at this point, Tennessee is still planning to administer the TCAP testing program. I know at least there's one state at least, and I think there are 3 others. I don't recall who those are, but the state of Georgia has applied and decided that, and gone through the federal government, that they will not administer high-stakes testing for this coming school year. Can locker use be minimized to minimize time in the hallway? Our schools are devising plans to minimize the use of lockers just to keep down the traffic and the number of students that would happen to be in the hallway. I think those are all the questions that were asked early that we didn't address in a discussion, but we'll entertain other questions at this point.
Dr. Stedman, one question I received today at the swimming pool was in reference to our teaching areas that are of greatest need, i.e. our math teachers, etc. And I assured them that that's something that we take careful attention to always, but do you mind just giving some addressing that area?
I guess what are you asking?
As far as because math instructors are just, especially our high-level math, geometry, and areas like that, are they're in a premium, and if we only have one for Freedom Middle, one for Poplar Grove, both of them get COVID. They were just thinking of different scenarios.
I mean, all we can do is try to recruit and retain the high quality teachers. If we have a situation like that we'll do what we have in the past, rely on substitutes and rely on maybe some virtual resources or some online resources, not virtual, but because the students will possibly still be there. But that will be a challenge because there are a limited number of math teachers for those higher level courses in our middle schools. But we'll have to be creative. I think in all situations, there's no way you can have a a plan, as we've talked about, these are imperfect plans, and I don't think you can plan for every scenario. You have to be creative when those issues come about, and that's what we will continue to plan to do, just as we have done in the past, because we have had those teachers who have become ill with something other than COVID. We've had situations of cancer where one of those teachers had to be out. So, I mean, we'll just have to be creative in how we address the needs of our students.
The last question I had was just in reference to making sure that, since I live in Founder's Point, we have our new sidewalks. I shared with them that I'm sure, our school would love for our students to choose the transportation option of walking, riding, bikes, etc., especially because that's something that we have available for us. For those who are going to use busing infrequently, i.e. inclement weather, will that be something on the form that we generally fill out? Will that be something that we'll have as an option? Most of the neighbors said that they, are looking forward to making sure their kids have rain gear so they don't have to use the bus at all, so that, that's freed up for other families that are needed. But that was a question that they had.
Well, they will need to at least indicate that there are a possibility of riding on an occasion, so we can make some plans, because we will have assigned seating for our buses. So, that could be we can adapt on those inclement weather days, but it would be helpful to know so that Mr. Alexander can prepare and plan in case that, for example, Founder's Point, we know most of the students will probably be walking since we have the new sidewalk, but in inclement weather days, he could be aware that we may have 10 more students that plan to ride during those situations. So it would be helpful for them to notify transportation of their plans prior to inclement weather.
Thank you.
Not the day of inclement weather.
Yeah. Thank you.
I had two questions. One was for Selby. You had said that the cases being reported positive may have already resolved because it's taking so long to get cases back. So actual numbers could be lower than anticipated. Okay. And that would be something we would consider in our evaluation of returning to school. One thing I just want to comment, I think we already touched on, but we need to clarify, because when I looked at this, I felt like the metrics made the decision. I know we have that in there, but I know a lot of parents have already said, well, we already must not be going back to school because we're at this percentage of cases. So I just think when we present this, if we could make sure we've added some verbiage or communicated what some of the other things we're going to consider before we make our decisions, that might be helpful.
Where do you want it added?
Well, I think just where you already had it.
And I like
okay.
what Dr. Esslinger said, this number triggers.
Yeah.
Looking at the scenario.
Right.
I think people are fixating on that, at least the ones that I've talked to, and are very concerned. I mean, everybody I've talked to wants their kids back in school. 99.5% of the population supposedly is healthy at a 0.5% infection rate, so people want their children in school at that, because that's how they're viewing it. I know it has different factors with infectious diseases, but anyways, we might want to beef that up.
I think that could be question 1 under the FAQ document, because
Yes.
that's probably going to be one of the most frequently asked questions. So
I agree.
Suzanne, if we have that as number 1 on the list, and they can see that there are a lot of factors or variables that play into the decision whether or not we'll be in school.
Thank you.
I have a question, please. I feel like most of our classrooms have access to outside easily. Are we looking at, are teachers able and encouraged to take their classes outside when they still can, or when the weather's appropriate, or do lunch outside? Because lunch, is when kids don't have a mask, they're talking, they're eating, and it's just the chance for spreading is greater than at that point.
Well, principals have been working, the elementary principals have worked together and the upper grades have worked together as well. They have all been talking about scenarios and looking at the possibilities of where they're going to feed, whether it's in the cafeteria or in the classroom, in cases where they can go outside. I don't recall exactly what their planning is, but I know they will utilize every inch of that campus and provide opportunities for those students and for teachers and students to have a safe place to consume their food. Now, I'm probably guessing that the weather early August is not going to be conducive for lunch outside, but in the fall, it'll be a perfect time to have them outside. And they'll have to determine, who goes to what location to continue that cohort spread and to keep students from mingling together, but they can easily do that.
I think another consideration in this is to make sure that as students come and go, or the potential of coming and going through other doors, is all consistent with our security plan.
I'll add something to that. So that's something that we did talk about in one of our conversations, that it's important to, as you guys have heard me say before, to keep the limited access and limited availability to doors. And so we talked about different ways they can maybe identify a couple other doors they can use to go in and out. But those will be identified, people know what they're used for, they will be identified as a frequently or high-touch surface, that type of thing, to make it more feasible for them to be able to go outside and do that type of thing. So those are definitely discussions that we've had already.
Okay, good.
One more question. Fire drills. That was a question that came up too.
So,
And I left the swimming pool after that.
I left the swimming pool. What's the specific question about the fire drills? Because there's a few things that I can address. Do you want me just to address what? Okay.
Yeah, it was just, again, the social distancing and just,
Right. So a couple things that we've been told for fire drills is, number one, yes, when they do a fire drill, it can be the same exit point they'd used before, the same location they went to before, they just have to be socially distant or social distance outside. The other thing that we've been told is that, and I don't think this is any of our plans, but if for some reason we ever had to do a hybrid schedule where some kids come Sunday and some kids come other days, we would have to do double the fire drill, so all the kids would have had a fire drill. I don't think that that's something that we're considering, but that's just something that the fire marshal has made us aware of. But other than them being socially distant outside, having their masks on as they're, exiting and, as they're in the hallway, that type of thing, it's nothing has really changed. They'll still be logged in the same location they've always been logged and reported in our online safety plan, and the state can access that as they need. So that's really the only difference, is that we have to just be very aware that they're distanced when they're leaving and when they're outside waiting to be told to come back in.
thank you.
Yes, ma'am.
other questions?
If we had a scenario where we, my bent is I hope we're all in school, but if we had a scenario where we went virtual, would we in September or October say, well, now we can come back? Or are we going to stick to that for a semester, even if we could still come back?
I don't foresee us keeping kids at home when
If
we
we
can
don't
be
have-
back in
okay.
school. I mean, obviously, we don't want to ping pong
Right.
2 weeks out, 1 weekend, back and forth. I think there'll have to be some really significant discussion. But I don't, just because we go virtual, if we had to go virtual and, like you said, in September, end of September, that doesn't necessarily mean we would stay out until January. I think you would have to consider all this, the entire situation, because as we've all agreed, or most people have agreed, I think, and indicated they believe and we believe that the children are best served if they're physically in the school. So that will continue to be our focus.
I want to just say I really appreciate this plan. I can't imagine how much time it took to put this together, and who would have thought we had to ever even do this. So I feel like our district is really set on whatever we decide to do. Of course, I think our students will rise to the occasion. I am worried about what might happen if they're all at home, but I'm thankful that we have good plans in place. And I really appreciate it because I know it's not how I expected to spend the summer.
But thanks for the discussion, thanks for the questions, and we don't have, I'm sorry, go ahead.
I just have one thing. On Monday night at the board meeting, we will hear a very condensed version of what we just heard tonight, and we will vote to adopt the plan, giving the director latitude to make changes as the situation is fluid and these changes as required. So think about that, how you might want to frame up a motion to do that. Okay?
Okay. All right, thanks, everybody.
Thank you.
Thank you, everybody.
Thank you so much.